Before we do anything else today, let's do a very simple men's health self-check. In the next 30 seconds, you're going to get a quick snapshot of whether blood in your urine after 60 may deserve more attention right now. No panic, no complicated language, no guessing, just honest answers. If you are over 60 and you have seen blood in your urine, this matters more than many men realize, because blood in the urine creates a very specific kind of fear. It is visible. It is alarming. It feels impossible to ignore. And yet, many older men still do one of two things. They either panic before they understand the pattern, or they try to calm themselves down by assuming it must be from something simple. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 warning patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether your body may be showing a more reassuring pattern or one that deserves closer attention. And stay with me until the end, because the #1 mistake men make with blood in the urine after 60 is the one that keeps them focused on whether it hurt, while missing what the bigger pattern may actually mean. Let's begin. You start with 7 points. Number 1. Have you seen visible blood in your urine, even if it only happened once? If yes, subtract 1 point. Number 2. Has the blood come and gone, or appeared more than once over time? If yes, subtract 1 point. Number 3. Did the bleeding happen without pain, burning, or a clear explanation? If yes, subtract 1 point. Number 4. Do you also have urinary changes such as frequency, urgency, weak stream, or getting up more at night? If yes, subtract 1 point. Number 5. Do you have pain or burning during urination, lower back pain, side pain, or pelvic discomfort along with the blood? If yes, subtract 1 point. Number 6. Have you been telling yourself it was probably an infection, a stone, or just my prostate, without asking whether the symptom still needs a proper evaluation? If yes, subtract 1 point. Number 7. Have you been waiting for the blood to happen again before deciding it matters? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing many obvious warning patterns right now, and that is good news. If you scored 4 to 5, your body may be sending mixed signals. That does not automatically mean cancer, but it does mean the pattern deserves attention. If you scored 3 or lower, please do not panic, and please do not shut down. Many older men live in exactly this uncertainty, because blood in the urine can come from several causes. The goal today is not fear. It is clarity. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and what worries you most right now. Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. Blood in the urine, also called hematuria, has many possible causes. Cleveland Clinic says blood in your urine does not always mean you have a serious condition, but it can be an important warning sign that something is wrong and should not be ignored. It specifically says to contact a healthcare provider as soon as you find blood in your urine. Cleveland Clinic also lists possible causes such as urinary tract infections, stones, bladder inflammation, enlarged prostate, and certain cancers. Mayo Clinic says bladder cancer symptoms can include blood in the urine, frequent urination, painful urination. It also notes that bladder cancer risk is higher in people over 55 and is more common in men. The American Cancer Society makes one of the most important points older men need to understand. It says blood in the urine is most often the first sign of bladder cancer. It may be enough to turn urine orange, pink, or dark red, or it may be so small that it is only found on a urine test. It also says the blood may not be visible every day. It can go away and then come back. And early bladder cancer often causes bleeding with little or no pain. That last point is exactly where many men get misled. They think if it does not hurt, it cannot be serious. But sometimes painless bleeding is exactly why doctors take it so seriously. So now let's count down the 3 biggest messages your body may be sending when you see blood in your urine after 60. We're going from number 3 to number 1, and number 1 is the one most men misunderstand the longest. Number 3 is this. Your body may be telling you that blood in the urine is not something older men should watch and wait on casually. This is one of the first things I want older men to understand. Blood in the urine may come from many causes, yes. Infection, stones, inflammation, prostate enlargement, and other non-cancer problems can all be part of the story. But blood is still blood. It is still a visible signal. And after 60, doctors do not want you treating it like a harmless curiosity. Here is how to notice this more clearly. Ask yourself whether you are minimizing the symptom because it stopped. Ask whether you are telling yourself that because there was no pain, it probably was not important. Ask whether you would be taking this more seriously if the blood had shown up somewhere else in the body. That matters. What should you notice? The fact that visible blood changes the conversation immediately, not because it guarantees cancer, but because it means the urinary tract deserves a proper look. Why does this matter? Because a lot of men make the mistake of waiting to see if the body repeats the warning before they decide the first warning counted. The most common mistake is assuming that a symptom only matters if it stays or gets worse right away. If you need an easier version of this check, ask yourself one question this week. If the blood never happened again, would it still deserve attention? In an older man, the answer is often yes. Number 2 is this. Your body may be telling you that the pattern around the blood matters more than the shock of seeing it. A lot of men focus only on the color. They think the whole question is whether the urine looked pink, red, rusty, or dark. But doctors usually look at the full picture. Was it painless? Did it come back? Was there burning? Was there urgency or frequency? The American Cancer Society says bladder cancer can also cause changes in bladder habits or symptoms of irritation, including going more often than usual, pain or burning during urination, feeling like you need to go right away, trouble going, weak stream, and getting up many times during the night. It also says advanced bladder cancer can bring lower back pain on one side. Mayo Clinic also lists frequent urination, painful urination, and back pain alongside blood in the urine as symptoms that can happen with bladder cancer. Here is how to think about it more clearly. Blood by itself matters, but blood plus a changing urinary pattern matters even more. Blood plus back pain changes the story. Blood that comes and goes does not automatically become reassuring. In fact, that stop and start pattern is one of the reasons men delay too long. What should you notice? Not just the presence of blood, but what is traveling with it. Why does this matter? Because if a man focuses only on the moment he saw blood, he may miss the evidence that his urinary system has been changing for weeks or months around it. The most common mistake is treating blood in urine like a single event when it may actually be the most visible piece of a longer pattern. If you need an easier version, ask yourself this. What else changed before, during, or after the blood showed up? That question often reveals more than men expect. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be seeing frightening symptoms like this and trying to make sense of them alone. And if you've made it this far, let me know in the comments which urinary symptom men are most likely to keep to themselves. Now let's get to number 1. Number 1 is this. Your body may be telling you that after 60, doctors start the cancer workup sooner than many men expect, especially when blood in the urine is unexplained or painless. This is the message older men miss the most. Many men think the workup starts only if the bleeding is severe, constant, or painful, but that is not how doctors think about it. In older men, visible blood in the urine, especially when it is painless or not clearly explained by something obvious, often moves the conversation toward ruling out cancer rather than waiting around for proof. And there is a reason for that. The American Cancer Society says early bladder cancer usually causes bleeding with little or no pain or other symptoms. That means waiting for pain can be exactly the wrong test. Cleveland Clinic says blood in urine can be an important warning sign and should not be ignored, while Mayo Clinic says if you notice discolored urine and are concerned it may contain blood, you should make an appointment to get it checked. Here is what I want you to watch for. Did you see blood and have no pain? Did it happen after 60? Did it come and go? Did you tell yourself that because it disappeared, the problem disappeared too? If several of those are true, that is exactly why doctors think differently than patients do. What should you notice if you stop minimizing painless blood? Urgency of attention. Because painless bleeding is not always benign, and in bladder cancer, it can be one of the earliest clues. Why does this help? Because it replaces false reassurance with better judgment. The most common mistake is thinking, if it didn't hurt, it probably wasn't serious. If you need an easier version, remember this. After 60, unexplained blood in the urine, especially when painless, is often enough to make doctors rule out cancer instead of waiting for the symptom to prove itself again. Now let me give you 3 daily boosters that can help older men think more clearly about blood in the urine. First, treat visible blood as a real signal even if it happens once. Do not wait for the symptom to earn your attention a second time. Second, track the pattern around it. Frequency, urgency, burning, weak stream, or back pain all matter. Third, do not let pain become your only standard for concern. Some of the urinary symptoms doctors take most seriously are the ones men describe as strange precisely because they did not hurt at all. Now let's close the loop. Think back to your starting score. If you scored low today, do not let that uncertainty disappear into the background. Recheck yourself in 2 weeks. Not because the answer will magically appear overnight, but because awareness changes how honestly you observe your own body. Today, we talked about blood in your urine after 60 and when doctors start the cancer workup. We looked at why blood in the urine should never be brushed off casually, why painless bleeding can still matter a great deal, how urinary and pain patterns change the level of concern, and why the biggest mistake is assuming the symptom only counts if it becomes constant, painful, or dramatic. This is not about panic. It is about paying attention before silence, wishful thinking, or temporary disappearance of the symptom start doing the thinking for you. If this video helped you, share it with another man over 60 who needs to hear it. And if you want to keep going, watch the next video on your screen, where I'll break down the #1 bladder cancer symptom older men dismiss as nothing. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.